All right, now looking at cardiac arrest, we can start with cardiac arrest. Just what is cardiac arrest?
Cardiac arrest means a sudden cessation or a sudden stopping in the function of the heart.
Okay.
This could be for a variety of reasons. For instance, the other term used was a heart attack,
Okay.
which basically means that the blood supply to the heart muscle has either been suddenly diminished or has been diminishing and suddenly comes to a cessation suddenly.
So for cardiac arrest, is stopping immediately, or heart attack is the one that stops immediately?
Arrest is complete arrest. You know, like when you arrest a prisoner, he can't go anywhere.
Okay.
Well, with an attack, you do have some time. There's still some blood flow, but they suddenly become very, very less. Arrest talks about either the blood supply or the electricity. Those are the two main things of the heart that can cause an arrest.
Okay.
Well, a heart attack has to do with the blood supply specifically.
Now, for these two, can you survive from either of them, or when they happen, and that's the end of you?
Generally, we say a cardiac arrest requires immediate intervention, usually in the first 4 minutes. Witness cardiac arrests and hospital cardiac arrests, patients recover from them.
Okay.
But the proportion is actually quite small, because less than 50% of the patients who actually do undergo a cardiac arrest actually recover, unfortunately.
Okay.
And especially if it's witnessed in the setting where people can actually respond quickly and provide resonance cardiopulmonary resuscitation. Hospital gives you a better chance of actually recovering from cardiac arrest. Heart attacks give you time. Usually within about 24 hours. If you have good care in the first 24 hours, you can actually improve. We prefer if you come to hospital earlier, within the first hour.
Okay. All right. Before we look at just some of the signs that probably these two present with, you're having a model here of the heart. You can just help us, for someone that has not understand how the two come about, how the two present themselves, just with differentiating, that is between a heart attack and a cardiac arrest.
This is a model of the heart, and it actually shows the heart in its entirety. Okay. So this talks about the chambers of the heart, and here you have the muscle of the heart and the blood supply.
Okay.
When you say heart attack, we're talking about the caliber.
Okay, you can just hold it.
We're talking about the caliber of the blood vessels. Specifically, these blood vessels that run on the surface of the heart. They're known as the epicardio coronary arteries, the blood supply of the heart. So the caliber looks like this, and unfortunately, what happens is that with high blood pressure, with diabetes, with sugar, sometimes with the genes, the caliber of the blood vessel gets narrower and narrower and narrower. So with a heart attack, you actually get sudden cessation or sudden blockage with a clot usually, meaning that the parts of the heart muscle distal or beyond the area that is blocked don't have blood supply. Okay. This results in actually a sudden area where there is a lot of generation of free radicals and other chemicals that cause a lot of pain. Most of our clients describe feeling like an elephant sitting on your chest, sense of impending doom, very severe chest pain here that could go to the jaw, the shoulder, or the left arm. So that's a heart attack. Because there are actually 3 blood arteries that run on the surface of the heart. Usually only one is blocked, usually. Sometimes 2. We could get a serial blockage of the arteries of the heart. So that you get one blocking, the another one follows it, another one follows it. This is not a sudden thing. It actually takes time. Okay. It takes time. Well, cardiac arrest basically means that the heart basically stops functioning suddenly. Either because a major blood vessel has been blocked, or because you have the wiring of the heart. Actually, there is some wiring in the heart. Here, the wiring of the heart causes abnormal firing, and the heart beats very fast, then ceases, or beats so fast, it's not even supplying blood to the rest of the body. Because that's the key function of the heart. It's actually a pump that supplies blood to the head and to the rest of the body.
Okay, for heart attack, you just mentioned some of the signs that probably a heart attack will present itself with. How about for cardiac arrest? Are the signs the same?
No, the patient just basically collapses. Okay. It's basically just a sudden
collapse. Like there's no warning?
Well, a heart attack can lead to cardiac arrest.
Okay.
Even things like severe asthma can lead to cardiac arrest. Okay. Very loss of blood supply, like if someone bleeds a lot, can lead to cardiac arrest. In other words, we're talking about totality of the function of the heart, the different ways the heart functions. When there's a cessation in one of the supplies of the heart, one of the main functions of the heart, you can get a cardiac arrest. Okay. So heart attack can precede a cardiac arrest, and generally we say a cardiac arrest is a terminal event before someone passes away, whatever it is that happened to them. Sometimes related to the heart, or sometimes outside the heart, related to cardiac arrest.